A package of bills moving through the legislature promises to expand access to and coverage of health care in the state. The so-called Live Healthy initiative calls for $800 million in new health care investments, but it comes as lawmakers double down on their refusal to accept millions each year in federal relief. I'm joined now by Dr. Nancy Staats, board-certified anesthesiologist and founding member of Florida's Health, a coalition advocating for affordable health insurance. Welcome, Dr. Nancy Staats.
Thank you.
Dr. Christina Cauffield, Chief Executive Officer of Lutheran Social Services. Good morning.
Good morning.
And Scott Darius, Executive Director of Florida Voices for Health, which supports Medicaid expansion. Good morning.
Morning.
And we want to hear from you as well. Do you think the state should accept federal money to expand Medicaid? Join the conversation. Give us a call at 904-549-2937. You can also email us at firstcoastconnect@wjct.org, and you can message us on Facebook, Instagram, or tag us on X at FCC On Air. Dr. Nancy Staats, Florida is one of just 10 states that continues to reject federal funding to expand Medicaid coverage for the poor. Remind us of where this started.
So the brief timeline is back in 2010, the Affordable Care Act was voted on and passed, and then in 2014 was implemented. By 2016, we had about 14 or so states, and by 2019, we had around 39 or 38 states, and now here we are in 2024, fully 10 years after the law was implemented, and there remain these 10 holdout states who refuse to expand.
And so the Affordable Care Act, also known as Obamacare often, it doesn't provide subsidies for people with low incomes below the poverty level. And that's because the law called for them to have Medicaid instead. But instead, there are a number of very poor people that aren't able to afford health care coverage. They kind of fall into this gap, this Medicaid gap.
Correct. And Florida is among the greatest offenders. I would say the only two worse are Alabama and Texas. Excuse me. But we require a parent to have 28% of the federal poverty level income, which is extremely low.
What is that about?
It's about $7,000 a year, in order to qualify right now. And if you have no children, there is no option. You're in the gap. It's called the coverage gap.
So no matter what you make, if you don't have children, you're not eligible for Medicaid.
Well, you're technically, yes, correct.
Okay.
In Florida, yes.
And you fall into that gap if you make more than $7,000 a year. So essentially, if you make $7,000 a year, you're not eligible for Medicaid, but likely can't afford health insurance.
Correct. You cannot afford things on the marketplace, even with subsidies. As you know, that's such a low rate to live on. So we have huge numbers of people. In fact, 1 in 5 adults in our country who do not have health insurance, who fall in this gap, are from the state of Florida.
Scott Darius, initially there was resistance to this expansion of Medicaid because states were concerned that it was going to cost them money. And it does cost some money. Explain the breakdown there in terms of how the state benefits and how the federal government pays.
Yeah, I tell people that maybe the only good thing to come from the fact that Florida is among the last 10 states to expand is that we've gotten to see this experiment play out in 40 other places. So whatever conclusions we draw aren't just kind of based on crazy assumptions, but it's based on what we've seen play out. And every state to have expanded, a couple of things. One, none of them have gone back on the deal. Every state has the option to pull out if they decide it hasn't worked for them. None of them have. I think we've also seen that every state that's pulled this off has actually managed to save money in the very year that they've expanded. Florida Policy Institute, one of our great partners, estimates that Florida would save $200 million a year, and that's even after we pay our state share. I had the pleasure of talking to a senator from North Carolina where they recently expanded, and he mentioned, based on their expansion, which started December 1st, that they had added over 600,000 people to their Medicaid rolls, but are paying less for the program this year than they did last year. And that's because, you cut out the need for emergency room costs, all the other patchwork programs that we have built into the system. Once you eliminate those things, you're actually saving money in the long run.
And emergency room care does become a fallback. Is that true?
It's one of the biggest problems we have here in the state. When you think about just how much money we spent on preventable dental care in 2021, most recent numbers I saw, it was $500 million we spent on preventable dental issues in emergency rooms, and that's not counting physical health and all the other things that come up. And you can see Live Healthy was meant to address that, right? Like that was the big talking point was we have to lower emergency room costs because of it being the highest. Yeah, the care you're paying for at that point is the most expensive care.
So let's talk about Live Healthy, Dr. Cauffield. This is a set of bills the Senate has already signed off on, still moving through the House at the state level. And it is ambitious, and it is lawmakers' response essentially to trying to tackle this problem without accepting Medicaid. Tell us a little bit about Live Healthy and what it promises.
Well, there's a lot of positives in this bill. And one thing is it's really going to be focusing on rural areas in the state of Florida. They are wanting to attract physicians, other healthcare professionals to come into the rural communities, which are basically notably underserved. And they're offering a lot of incentives for physicians and other healthcare professionals to come and practice in rural areas. I'm very excited about this bill because it really increases the need and the lens on behavioral health care. One of the things that the bill also supports is lowering the threshold or the reciprocity for other professionals, behavioral health professionals, to come into the state of Florida that are licensed in other states. Right now, Florida is very strict and not big on having other people come in from the state. They have a lot of barriers. You have to come in and basically re-credential, sit for licensure, and it's a real deterrent for a lot of folks that live in other states. This will open that up. So there's some very good things that are on the horizon if this bill passes.
What is the problem of rural health care? Why is that a deficit in the state?
I think because a lot of professionals want to live in urban communities. If they're not used to the rural lifestyle or don't particularly gravitate toward that, it's hard for them to come in and want to stay. And we find that a lot of professionals that are from rural areas that go to school and get licensed want to leave and move into other communities. So it has been a challenge. Resources are usually tighter in those areas. So again, I'm happy that they're focusing on the rural communities.
Scott.
Yeah, if I can jump in just to say that, right, just to preface, I don't know if folks know this, but we've had 4 rural hospitals closed since 2019. 3 of them closed in March of 2020, which might, that date might jump out at you for one reason or another. And so Florida Voices for Health, we had the opportunity to go to a couple of these counties over the last few months. We just held a couple of roundtables just to talk to people about what it's been like to lose a hospital system and kind of what caused it in the first place. And yeah, the things we're seeing don't come as any surprise to anyone who's like living there, right? It's the fact that you have these hospitals that are serving such a high number of uninsured people and folks on Medicaid where there's already such a low reimbursement rate. So basically, everyone that they're seeing, they're losing money on for the most part. And it becomes unsustainable eventually, and folks are leaving. Now, the reason I cared in the first place was 10 months ago, my wife gave birth to our first kid. We live in Gainesville, and so we're 15 minutes from Shands Hospital. But it took 2 days to be admitted to the hospital for an induction because they had such a long list of people waiting to be induced. And basically what's happening in rural parts of the state is folks are 90 minutes, 2 hours away from a hospital to deliver a baby. So when we got out to these roundtables, the first thing we did was just, one of the first things that stood out to me was that all the worst case scenarios that I had imagined as hypotheticals were actually happening to people. People were losing limbs because they had to go an hour and a half to a hospital. People were having babies on the side of the road because they couldn't get to a hospital in time. So it's just to say that what's happening in our rural communities is a problem, and something that we should address. And I'm so happy Live Healthy is working on the provider side of things, but there's, I think, more a holistic view too that needs to be taken.
Scott, I want to ask you about that, though, because you talk about the low reimbursement rate for Medicaid. What is it that is that accepting more Medicaid would solve about that when it comes to taking those federal dollars, if that is in and of itself a problem?
So first, you have such a high number of uninsured, right? So every time those folks get seen, you got nothing back. It's zero. And if they have Medicaid coverage, something is better than nothing. If you're a provider, you're getting reimbursed a little something. Live Healthy, one of the great things it does is increase provider reimbursement rates on Medicaid. And that's just something that fundamentally needed to happen. So we're excited to see that be part of the next step. There's a whole lot more to say there, but yeah.
Dr.
And
Staats.
I would just add, it's also the hospitals. It's important that there's Medicaid coverage from a hospital system standpoint because their reimbursement is much more on par with what would be acceptable. The providers do get a low rate, but that can be adjusted. But without a hospital system, as a physician, how can you practice in an area? It really is a huge barrier. And unfortunately, eliminating just one rural hospital impacts fewer people, but the people it does impact, it's much greater impact because by definition, these places are few and far between to begin with.
So maybe we don't intuitively understand why losing a hospital would impact the providers there and their ability to provide health care. Why does it?
Because if you're an OBGYN, where are you having your deliveries? You need a hospital system, right? You need a hospital backup. Where do you do your surgeries? Where do you send your patients who need to be hospitalized overnight? There's almost no physician does not require, a relationship with a hospital system.
And the expectation is if this Medicaid were to be expanded, federal Medicaid, that there would be fewer uninsured so that the reimbursements at a rural hospital might be greater?
Exactly. And it's much more predictable when you have an insured population because you can predict your utilization. So, for example, in OBGYN, how many deliveries do we have? At least we have the Medicaid reimbursement going on. But right now, we have uninsured folks. And in our country, we've always cared for people who need care. So they show up at the emergency room and we take care of them, thank goodness. But it comes at a great cost because these hospitals now have to close and we're losing providers. And you can imagine why.
Well, we're talking about what's changing in Florida's healthcare coverage and what is not changing, which is including Medicaid expansion. If you've got questions, you can give us a call at 904-549-2937. You can also email firstcoastconnect@wjct.org, and you can message us on Facebook, Instagram, and X. We have a message from Susie on Facebook. She says it's been 10 years. We continue to elect people to the legislature who campaign on the government as the problem platform. So why should we expect any action from them? If the government doesn't remain the problem and they fix things, then they will not have a platform for reelection. Dr. Cauffield, there's obviously a lot of politics behind the expansion of Medicaid, and it's difficult to kind of find common ground on any issue these days.
It is a challenge. I think that with the Live Healthy bill, it's a start. I was pleased to see that, for example, it raises the eligibility rate for individuals from 200% to 300% of federal poverty level, making it easier for more families who want to go to free clinics, for example. So I think you see pieces in this bill that are moving in that direction without specifically stating that the state is moving toward Medicaid expansion.
And one of the goals of this bill is to increase the number of providers, to incentivize people to go to school in these fields, and to try to boost the ranks. Talk a little bit about that component of this set of bills.
Yes, there's lots of incentives for, particularly in the behavioral health care space, for individuals to gravitate toward this field and get their education. For example, there are monies coming in through this bill to hospitals for them to set up internship sites, for example, and training opportunities for individuals to move forward with their education. This is great news to us because, as we all know, we are in a real workforce shortage, particularly in the healthcare profession. And so anything to incentivize to bring more providers into Florida to be able to address this crisis is real positive news.
Scott, I know that one thing lawmakers have said in terms of refusing Medicaid, and Senate President Kathleen Passidomo made very clear that that's a non-starter. The Medicaid is not going to be expanded. But they have said, what is the point of expanding, reimbursements if there aren't providers? And that has been a real shortfall. So this initiative this year does something to help that?
Absolutely. Yeah. And right, I think we get, as Florida Voices, we talk so much about Medicaid expansion and the need to pursue that as a policy. But everything else that we talk about, because so much of our work is completely driven by the stories we encounter, by people who come to us and tell us what they see and what they've experienced, and we let that lead how we do the work. And I think what jumps out at me from that is that there's so many parts of the system that need fixing, right? We don't talk about Medicaid expansion to the exclusion of everything else. And the same way, we shouldn't talk about workforce to the exclusion of everything else. There's so many pieces of the system that are boxing people in so many different ways that, yeah, all the things should be discussed. And I think that's where we start to find common ground. That's where we start to break through a little bit, is if we're just willing to have a nuanced conversation about all the approaches that need to be put in place.
Dr. Staats, is there something that you think is changing in the fact that the legislature that has refused these dollars and continues to has taken up this issue so dramatically this year? I mean, this really is kind of a big sea change in a lot of ways.
Well, I at the risk of sounding a little negative, it's great that they finally are acknowledging that we are in a crisis. I mean, Florida is something like 47th out of 50 states in mental health coverage. I think we're dead last in dental coverage. It's I could go on and on, but folks don't like to listen to facts like that. The problem remains to me that there are federal dollars of which all of us pay into every year, year in and year out for decades, that have gone to states who have expanded. And we are getting nothing of those federal dollars that could cover a lot of our citizens tomorrow. All we'd have to do is expand. And Scott's 100% right. We can't think of Medicaid expansion as a panacea. This is a huge problem, but it's a great start, is to expand Medicaid. I think the Live Healthy is a smaller step forward. It's trying to do many of the same things, but at the cost of our own taxpayers' dollars. We're using Florida dollars to fund this, unless I am misunderstanding something. So if we expand Medicaid, we also eliminate a real problem called medical debt, which is what prevents people from seeking medical care after they've had an event. They can't pay off their health care bill, and they're afraid to seek preventative care. And medical debt is a huge problem.
The money that is left on the table, I've seen various estimates, but the Center on Budget and Policy Priorities says the state left $5 billion on the table in 2023 and estimates that we lose another $14 billion over the next 5 years. So it is real money that we're talking about that is not being used.
Yes, and so the $800 million we're spending now, it gives you a little perspective. Yes, it's a baby step in the right direction. I applaud the sentiment, but it's within our power to make a much bigger positive change.
The $800 million reference is the Live
Yes.
Healthy budget, right?
I believe it's
The
about
investment,
that.
yeah. Dr. Cauffield, what do you think about the priorities in the Live Healthy initiative? I know that you work in the field of mental health care. You
Right.
deal with a lot of uninsured
Yes, I
people.
do. Mhm.
So what is it about this set of priorities that you are most excited about?
I'm most excited about the workforce issue, encouraging other providers that are licensed in other states to come to Florida. So removing those barriers, because we are really struggling with that in our system of care. At LSF Health Systems, we have over 80 provider organizations that serve 23 counties, or a third of the state. And every single one of them is really challenged with finding credentialed licensed individuals to work in their organizations. For example, if you don't have the correct amount of licensed individuals, for example, to serve on a unit, by license, by the state license, you can't continue operating unless you have the criteria that is necessary to have the complement of professionals. And so you may have beds that are available for people to come in and get their treatment, but if you don't have adequate staff, then you can't staff up those beds.
Interesting. We actually have a message related to that from Tom on Facebook. He says, but how many medical professionals will want to come to Florida when the Florida legislature has created such a hostile climate for education that has teachers leaving the state in droves? I throw that open to any of you that care to take it.
It's a fair question to ask about, right? Like the people will move. There's an incentive to move, but context matters. The overall context of the state and how people feel, right? Like their relative comfort, I think is an important point to make. So just to say, I hear you, Tom. I don't have a great answer other than it's a great point to make.
A great point, Tom. But what I would also say is there are many providers who are already here who might consider staying. It may not attract more people in, but we're also losing providers at a faster rate than other places.
Why is that?
I think it's a combination of what Scott brings up, a hostile environment, lack of support for, following healthcare. I think COVID was tough on physicians in Florida.
Yeah, tough on providers for
Yes.
sure. A very difficult time. There is a proposal to put the expansion of Medicaid in the hands of voters, an initiative that is something that could come to the ballot as soon as 2026. Scott, tell us a little bit about that initiative.
Yeah, so being led by Florida Decides Healthcare, the goal is to get on the 2026 ballot and, I guess get 1 million petition signatures between now and then. They've officially kicked off. The reason I think we're so excited about the petition itself, the drive for it, polling in the state for Medicaid expansion has been high since we've had the opportunity to do it. And the most recent polling I've seen, support is over 70%. And, the state being what it is, however you feel about who the candidates are on the ballot, I think what we've seen in every election cycle is there's a difference. People are able to make a distinction between the people they want to vote for and the issues they support. And every time we've been given an opportunity to support, something that takes us a step forward, whether it's minimum wage or rights restoration, the people end up choosing whatever the popular sentiment is. So we feel very confident the same way about Medicaid expansion. And I'd encourage folks, if that's something you're passionate about, right? I encourage you to keep going to the legislature, keep letting them know what it is you desire. But there's also this really great opportunity to take the thing in our own hands and to get it done.
So people may poll that they want, health coverage, and in the simplest terms, probably are able to, think about that and process it. But a ballot initiative can be a complicated undertaking, and the language has to be very specific. I wonder what you think about how that translates. How are you able to put something before the voters that is clear enough to them about the implications of Medicaid expansion when it's a dense topic?
Yeah, it's not a sexy subject, insurance, unless you're, a football star, and want to talk about it. But seriously, I think we underestimate how our electorate understands these issues, and I would compare it to the recent ballot initiative to put reproductive rights on the ballot. The Floridians understand what expanding healthcare is and what it would do for them, and are in, as Scott indicated, in almost 2-to-1 agreement. This is good for our state. It's sad that we have to spend the money, like you say. It's a very tedious, expensive, time-consuming process to do it by ballot initiative. But the fact is, 7 of the last 8 states that have expanded Medicaid had to do it via a ballot initiative because they could never get legislator approval.
We know, traditionally when somebody makes an investment in healthcare, it's rare that they pull it back. And I think, Scott, you alluded to that. When states expand the Medicaid, provisions, they have not undone that. Is there a sense that this Live Healthy initiative, Dr. Cauffield, will be in place? Is there any reason that this still couldn't happen, the expansion, and then we kind of have the best of both worlds.
That's yet to be seen. I think that the Live Healthy bill is a step in the right direction. It has a lot of the initiatives that would help us bring in more funding. It would help with the workforce shortage situation. One part of the bill talks about an innovation council that they want to create to bring in more innovative approaches to healthcare, for example. And so I think that it's going to bode us well to see how this plays out, how it affects individuals that are uninsured or underinsured, and we'll see what happens in the future.
We have just a question on Facebook from Thomas. He says, if expansion saves Florida money, why would our legislature first not expand it, and second, create a program that they will have to fund with state money? Dr. Staats.
Well, that is the question of the hour, isn't it? I would suggest everyone pose that question to your legislator. There is a Republican legislator, by the way, Dr. Rudman, who is in favor of expanding Medicaid, but traditionally this has, even though there should be nothing political about healthcare, this has fallen out along party lines, and as you know, where things stand in Florida.
It's worth maybe we touched briefly on the threshold for who qualifies and who falls into the gap as if they're not eligible. But for a family, the threshold is about $30,000. So if you have a family of three that makes $30,000, you would not be eligible for Medicaid. If you're an individual who makes $17,000, you would not be eligible, Scott.
No, if you're an individual, like Dr. Stott said, if you're an individual with no dependent children, you don't qualify regardless of what you make. And then, in a family of three, the example we always use, the most you can make is 30% of the poverty level, give or take. And so that number changes a little bit every year as the federal poverty level climbs up. And right now, the most you can make if you're in a family of three is about $7,000 to $8,000 for the year. And so if your family, and you think about the industries that really are the backbone of Florida's economy, right? So retail workers, food service, construction, it's all those folks who make $25,000, $30,000 a year, and they fall firmly in the gap because they don't quite make 100% of the poverty level where tax credits would start and are over that 30% threshold where
I want to correct what I was saying. I think I apologize. Medicaid expansion would allow for an individual who makes $17,000 a year would be able to qualify for Medicaid, and a family of three that made $30,000, if Medicaid was expanded, they would qualify.
Absolutely. And to the question of why haven't we done it, right? There's this whole idea of who's deserving, and we don't want to give lazy, able-bodied people who aren't doing anything. We don't want to give them access to health care. Let's say that's your position. That's fine. That's not fundamentally who we're talking about. The people in the coverage gap are those folks who are working but find themselves earning too much to qualify for Medicaid in the state. In fact, there's a disincentive to work. The more I work, right, like how likely is it that the raise I get at work puts me not just like from Medicaid eligibility, jumps me over that entire gap to a place where I'm eligible for tax credits. It's just unlikely, right? The most raise, the highest raise any one of us has ever gotten, it feels like, is $1 or $2 at a time, and it just moves you closer to the gap. So there's really a disincentive to work sometimes that I think works against the whole idea of it's just lazy, able-bodied people who, want Medicaid coverage.
Well, it's a very important issue. We're going to stay abreast of it as it continues to evolve. Thank you so much for sharing all of the information and feedback, Dr. Nancy Staats, Dr. Cauffield, Scott Darius. Thank you.
Not a doctor.
Appreciate for being here. Thank you this morning.
Pleasure. Thank you.